I am Dr. Kim Andersen. I'm the Director of Psychology at the Center for Eating Disorders. I've been with the center since 1990. I have developed and I oversee all aspects of the psychological treatment in all areas of the program. I would say we stand out in terms of the training that we provide for all of our therapists and psychologists, especially those who are providing cognitive behavioral therapy. Our psychologists and all the therapists who provide CBT receive extensive training in the evidence-based protocols for this treatment. For example, our nurses receive training to be competent to assist patients in the milieu in the unit in practicing some of their CBT skills while they're there. For example, our occupational therapists have a group that is called the CBT Lunch Group, where they are there to coach and support and help patients through a meal. And because cognitive behavioral therapy is a treatment that you have to practice, and so you can come to therapy and have a group, or you could go see your therapist once or twice a week. But if you're not practicing in between, you won't learn. It's like learning anything. You know, if I'm trying to learn how to play the guitar, but I don't go home and practice, I'm never going to learn how to play the guitar. I'll be just as bad at playing that song as the first day I learned it. So they get the opportunity to practice all throughout the treatment. When everybody is comfortable and familiar with the cognitive behavioral techniques, from nursing to nutritionist to therapist, then patients can really benefit from being coached and practiced that way. Whether you're inpatient or outpatient, or you're in a group setting or with an individual psychotherapist, CBT is a structured, directive, collaborative kind of treatment. It can be experienced in a lot of different ways. It can just be psychoeducation or a group discussion or a discussion with your individual therapist. But most of the time it includes all these things, like education, discussion with peers or with your individual therapist, as well as a lot of written exercises, homework, self-monitoring, recording activities, journaling, as well as what we call interpersonal experiments or behavioral experiments. So for example, if an individual is working on body image and wanting to improve their body image, they would cognitively identify some of the thoughts that contribute to their negative body image and negative feelings about their body. For example, they may have the thought or belief that if they could look as they wish, everything would be okay. If they could control their weight, their life would be much better. So you would identify some of those problems with their thoughts and begin to challenge the distortions there. And then at the same time, behaviorally, there may be some work to be done. So for an example, if an individual is avoiding things because of their negative body image, they don't want to go to the beach or the pool because they don't want to wear their bathing suit because they feel so uncomfortable in their body. In therapy, an individual would work towards gradually exposing themselves to different situations where then ultimately, with all the cognitive support and with therapeutic support and planning, they can go to experience that kind of situation. So however it's presented, simply put, cognitive behavioral therapy is beginning to identify and modify problems with your thoughts and your behaviors. And you can do that in a lot of different ways. Individuals who are suffering from eating disorders are really suffering. So while it is hard work to go through, they're already suffering. So, you know, the good thing is they come out of it the other end, and then the suffering decreases. So for patients who are successfully treated, you know, aside from symptom control, you know, aside from being able to be comfortable in their body and being able to eat normally and not having the symptoms that are interfering with their life, all areas of life functioning improve. Interpersonally, they can go back and enjoy full, rewarding relationships in terms of academic and social functioning, and work functioning. You know, they're a full member of their life. Again, their quality of life is significantly improved when somebody overcomes an eating disorder. So they will be comfortable in their body, be comfortable with food, and what I hear patients talking about, you know, as I've experienced many patients who are fully recovered and go back to a full life, that they experience like fog is lifting, and they sort of can return to a life where, you know, they can really participate. So it's so much more than just being symptom-free and not going through the restrictive eating or the binge eating, but it's being, you know, comfortable with yourself overall and being able to enjoy your life again.